A favorite saying at Tulsa Spine and Rehab is stop chasing the pain. Dr. Sean Riley joins us. What does that mean, Dr. Riley?
Yeah, Scott. So many times I think we go to physicians with, obviously a current chief complaint. And, current chief complaint for this purpose, we could just call it low back pain with some leg pain. So the pain, obviously you're hurting. And so that was the driving force to take you into a doctor's office or a chiropractor's office, or whomever it may be. But so many times there's an underlying cause of why we're hurting. And many times it's not just straightforward. Obviously with, let's say, a disc herniation in your low back, we spoke about a disc herniation resulting in maybe irritation of the sciatic nerve, and you have pain down into your leg. Well, if we do imaging, an MRI or a CT scan, and it shows that we've got a disc issue, that's a common cause of a problem, but are there other contributing factors? And that's kind of what I wanted to speak about, is that as patients, we're constantly chasing the pain or the cause of what's bringing us in necessarily, and not going a little bit deeper about what is potentially the dysfunction or the area where we may be having some issues that could contribute to that disc herniation. So I talk to a lot of my patients about identifying dysfunction, kind of a fancy term there. And what essentially that's meaning is when I'm taking a patient through their initial history and their physical, and I've talked about functional movement assessment and trying to determine where they're mobile, they have mobility issues or some stability issues potentially, how identifying those areas of dysfunction, how that potentially could create to another problem downstream, so to speak. So for the purpose of the low back with the disc and the leg pain, many times it's secondary to something else. A lot of times it could be secondary to mid-thoracic tightness, that area between our shoulder blades, or hip tightness for us that sit for extended periods. So over time, what happens, Scott, is we sit, we get tight, we start to lose flexibility, and then it's just a game of compensations. I refer to that little phrase many times in the clinic, a game of compensations, that when we have a breakdown or an area of dysfunction, whether one part of our body, you're typically going to develop a compensation that could potentially, or many times does, result in some form of injury. So we get tight between our shoulder blades, weak throughout our core, tightness in our hips. We have increased stress and irritation and pressure that's put on that disc, and we develop a disc herniation. And now, sadly, what we're treating are symptoms. And I always talk to patients about staying out in front of symptoms. Let's treat the area of dysfunction to avoid injury. Because once we get to that disc herniation or, the injury, now we're managing a very specific type injury with whether it's shots or medications. Sadly, many times surgical intervention or surgery is necessary. Obviously we're going to address those areas of dysfunction, but I don't want to say we're too late. Now we're dealing with trying to manage an injury along with some of these areas of dysfunction. So I think as a patient, many times it's difficult to do. Who wants to go in and get checked out when we feel good? That's the issue. I would tell a lot of the folks listening is that, check for those kind of those warning signals. I joke with patients that your check engine light's on. So, let's say you start to notice that you've got recurring back pain on a monthly basis now, and it's just essentially mechanical low back pain. Get in and get checked out. And hopefully we identify those areas of dysfunction, and we're not dealing with a very specific injury like the disc herniation. And hopefully staying out in front of it, we can prevent the nasty injuries, keep you maintaining normal activities and doing what you'd like to do.
When it comes to identifying the contributing factors, as you call them, it sounds like communication might be your number one tool.
Absolutely. Typically, or very commonly, I'm able to sit with a patient and listen to them about what their problem is, where they're hurting. More importantly, what do they do? What do they don't? What are they not doing? Okay, he's an accountant. He's sitting for extended periods. What's your activity level like? Well, I'm not very active. Or I drive a truck, I'm sitting in a fixed position for extended periods throughout the day. I don't stretch. I don't work on mobility. So very commonly with the low back example, it's going to be, pretty apparent that they're tight between their shoulder blades or throughout their hips. And I can't stress it enough. Like you mentioned, just open line of communication with my patients, sitting down and visiting with someone that understands these, identifying the areas of dysfunction and trying to stay out in front of it. Many times, like I said, you can determine what the issue is before even an exam. So I would encourage all the listeners and those out there that, it's worth a conversation with a practitioner or a medical provider just to, maybe identify some of these things and give you a few simple things to start working on.
Stop chasing the pain and get to the source of what's causing your problems. Contact Tulsa Spine and Rehab and see how they can help. 918-743-3737.